오빤 강남스타일 강남스타일 낮에는 따사로운 인간적인 여자 커피 한 잔에 여유를 아는 품격 있는 여자 밤이 오면 심장이 뜨거워지는 여자 그런 반전 있는 여자 너는 선어해 낮에는 너만큼 따사로운 그런 선어해 커피 식기도 전에 원샷 때리는 선어해 밤이 오면 심장이 터져버리는 선어해 그런 선어해 아름다워 사랑스러워 그래 너 hey. 그래 바로 너 hey. 아름다워 사랑스러워 그래 너 hey. 그래 바로 너 hey. 지금부터 갈 때까지 가볼까 오빤
What a dream. I've dreamed of experiencing my first ever community health nursing experience. I've dreamed of being able to perform the hand job successfully.
But wait, isn't that too fast? What will be the definition, the purposes, as well as the step-by-step procedure in performing the hand job?
Hello, good day. I'm Charlene Ortiz Desiderio, a student nurse from Wesleyan University, Philippines, College of Nursing and Allied Medical Sciences, BSN Level 2 Block 1. And for today, I'm gonna be demonstrating the hand rub. But in order for us to be enlightened about this procedure, let us first define hand rubs. Hand rubs are more specifically known as alcohol-based hand rubs. So these alcohol-containing applications, which can either be in the form of a foam or a gel or a liquid, are all designed for the application of the hands, as you can see here, in order to inactivate the microorganisms and temporarily suppress their growth. So each type of alcohol could contain more than one type of alcohol and other ingredients such as excipients and humectants. So each type of alcohol varies from brand to brand, from manufacturer to manufacturer, from ingredient to ingredient, but all of them just serve a single purpose, and that is to promote and prioritize the safety of our healthcare providers and their clients by preventing the transmission of microorganisms. But the thing is, maybe you are wondering how does hand wash differs from a hand rub. These two terms have been commonly and mistakenly used interchangeably, but they're actually not the same. As we all know, hand wash also serves the same purpose as hand rub. However, in hand washing, we need to have a material more than just an alcohol. We need to have at least a good source of running water, such as the faucets, soap of course, and some disposable or sanitized towels. Wherein in hand rub, you just need to have an alcohol or hand sanitizer, and then we're already good to go. But let us not forget that we are in community health nursing, and as community health nurses, we are trying the best that we can in order to bring nursing care and counsel and healthcare services to the public sector, to the community. And in reality, we cannot expect every single community in this planet to have been blessed with sufficient and well-functioning faucets and other forms of water systems. Not every single community have enough water source for their residents. That's why hand washing is not really applicable in a community setting. But there's where the concept of hand rub comes in. Hand rub becomes more advantageous in the setting because it is more efficacious, it is more skin-friendly, and it is faster to perform, making it more accessible and more convenient to perform, or more convenient manner to promote safety and wellness of the people. Now for the purposes of hand rub. First, to reduce the number of microorganisms in the hand, and second, to reduce the risk of transmission of these microorganisms from the nurse to the client and vice versa. Because as we all know, our hands are one of the dirtiest parts of our body, and everything around us can be contaminated by these tiny living organisms called microorganisms, which some of them specifically are called pathogens, which are carriers of diseases, of infections. And in order to halt the spread of these pathogens, of these microorganisms, we should always keep on practicing hand hygiene, hand washing, and hand. Meanwhile, for the assessment, first, we will assess our clients for the presence of any factors that could increase its susceptibility to infection or the possibility of any undiagnosed infection, such as the presence of the HIV, or also known as the human immunodeficiency virus. And then second, for the use of any immunosuppressive medications. Third, for any recent diagnostic procedures or treatments that have penetrated the skin or the body cavity. And then lastly, we're going to assess our clients for the signs and symptoms of infections. And then second, we're also going to assess ourselves, the nurses or other healthcare providers, for their nails. Their nails should be clean, it should be short, properly trimmed, with no cuts, no nail polish, and no wounds. And of course, we also have to assess the availability and the functionality of all the materials and equipments needed. Moving on to the planning, of course, we also have to gather and prepare all the necessary materials just to make sure that we aren't forgetting anything, and everything that we're gonna be using is accessible and organized. So as I mentioned earlier, in hand rub, we're only gonna be needing a single material aside ourselves, and that is alcohol. So we can use different variations of alcohol. So we have this liquid type, this is the usual or the most common type. We also have this foam type, but if you have this packet size gel sanitizers or hand sanitizers, we can also utilize this. But for the sake of this demonstration, to make this video informative, I'm also going to be showing you additional materials that are usually used in hand hygiene, particularly in hand washing. So we're also going to be needing some soap, some tissue papers or disposable towels, some sanitized towels, some pair of sterile or surgical gloves, and lastly, we're also going to be needing a faucet or any source of running water. Now let's proceed with the step-by-step procedure. So first, we're going to assemble all the materials and facilities needed. And in the usual healthcare setting, we're going to be arranging all the materials in a linear arrangement just to make sure that everything comes handy and accessible. But since we're only going to be dealing with an alcohol, we are no longer going to elaborate on that. Second, we have to remove and secure all the loose jewelries in our body, for example, the wristwatch, the name tag, or any other accessories that could interfere with our hand hygiene, and for the meanwhile, keep them inside our pockets. But for the sake of this demonstration, we're no longer going to elaborate on that. Moving on to our third step, we're just gonna prepare and get our alcohol here. And as I've mentioned earlier, feel free to use any type or variation of alcohol available in your home. And we're just going to apply a palmful of the product in our cup hand. So this is our cup hand. We're going to make sure that it is palmful and it covers the surfaces of our palm. Moving on to our fourth step, we're just going to rub our hands together, palm to palm, in order to spread or distribute the alcohol along the surfaces of both palms. For the fifth step, we're just gonna put our right palm over the left dorsum and rub it together with interlaced fingers. This is to make sure that we are also able to distribute the product in the spaces between the fingers. We have to repeat it on the other side. The left palm over the right dorsum. And for the sixth step, we're just gonna put our palms together, palm to palm, with fingers interlaced, and rub it gently. Now for the seventh step, we're gonna move on with the back of the fingers of the opposing palms, as you can see here, with fingers interlocked, and rub them together, gently. And obviously, we have to repeat it on the other side as well. And for our eighth step, we just have to rotationally rub our left thumb clasped on our right palm, just like this, and vice versa. So we're gonna repeat it on the other side. The right thumb clasped on the left palm, rotationally rubbing it. And for the ninth step, we just have to make sure that the remaining fingers are also clean. So we're gonna rotationally rub the remaining fingers of the right hand, the clasped fingers of the right hand over the left palm, and repeat it on the other side. The clasped fingers of the left hand on the right palm. And then lastly, once dry, your hands are safe. Wow, that was pretty fast and easy to remember, right? So those are the standard steps set by the WHO, the World Health Organization, in the performance of the hand rub. But for the sake of this demonstration, as you can see, I really took my time to introduce the step-by-step procedure to you guys. That's why it took me a little bit longer than what is ideally set for the duration time of the WHO, which is just about at least 20 to 30 seconds to finish the entire procedure. But moving on from that, let's have our words of wisdom about hand rub. And let's take with the 2019 research. According to that, 16 million people each year in this world die because of the healthcare-associated infections or the nosocomial infections, or more commonly known as the HAI. And what is really shocking is that 53% of that huge population die because of the lack of knowledge and lack of sanitation in the conduct of the healthcare providers and nurses. Isn't that ironic? That's why, as a student nurse and as a future health professional, we should start making a change by promoting wellness and safety and cleanliness by starting within ourselves. And we can start now. Amidst the pandemic, we can help in battling the lethal unseen enemy by promoting cleanliness within ourselves. Let us start putting everything we are learning into these nursing subjects, especially in hand rubbing, hand hygiene, and hand washing, into practice.